everyone, my name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar entitled 2016-17 Census of SBHCs, announcing our new shorter census. Today's presentation will describe the 2016-17 census and the steps we've taken to make it a shorter and easier survey to complete. But before we begin, we have a few housekeeping reminders. First, help us with our attendance count. If you are viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that will meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars for topics such as the ones you are viewing on your screen. I will now turn it over to my colleague, Haley Love.
Good afternoon, everyone. My name is Haley Love. I'm the Director of Research and Evaluation with the School-Based Health Alliance, and I will be presenting this afternoon alongside my colleague Nirmita Panchal, our Research and Evaluation Manager. I just want to start by saying thank you to everybody for joining us this afternoon. We've spent a lot of months getting ready for our census. We're getting close, and we're thrilled that you're here this afternoon to be a part of this webinar. We've worked really hard with a team of colleagues here at the Alliance to prepare for the 2016-17 census. I just really want to thank everyone for those efforts that they've invested and that they'll continue to invest over the next months to make this initiative strong and to reach our goals. So our objectives for this afternoon, we're going to talk briefly for those who may be new to the census about what is the census of school-based health centers. Then we're going to jump into what's new in the 2016-17 census. I'll talk about the nuts and bolts of census completion and incentives and targets. Then Nirmita is going to give you a demo of our new census portal where people will be asked to enter their data about their school-based health centers. And at the end, we'll take time for questions and answers. So let's get started. What is the census of school-based health centers? The Census of School-Based Health Centers is a survey conducted by the School-Based Health Alliance to collect information about school-based health services. We collect data on school-based health center locations, staffing models, the services provided, the populations served by the programs, and funding sources. These are really vital data to demonstrate the breadth and impact of school-based health centers nationwide. They're used to advocate for school-based health centers and help describe the hard work that school-based health centers do every day. We build on a really long history of collecting data from the school-based healthcare field. Starting in 1998, the School-Based Health Alliance started collecting the census data every 3 years, but it was actually collected since 1985 from other partnering organizations. If you go to our website, you'll be able to see the census reports dating back to 1985. So here's what you've been really waiting for. What's new in the 2016-17 census of SBHCs? I think the most important information for our field is that it's shorter. It's dramatically shorter. It includes 25 questions and should take an SBHC no longer than 15 to 20 minutes to complete. We went through a really rigorous process over the past several months, looking at every question, figuring out why we were asking it, how we were asking about it, and if the census was the right place to be asking this question. This process allowed us to whittle the census survey down to key questions that we think are essential for describing the model. And we'll use other mechanisms like anecdotes and case studies to capture information about other questions. The second piece of information that we hope will be music to your ears is that we've made it easier to complete the survey for multiple school-based health centers. So the majority of individuals who complete the census complete it for more than one school-based health center. They, on average, are completing the survey for 3 school-based health centers, but we have a huge range. So the changes that we've made that Nirmita will show you shortly in her demo are that sponsoring organizations with multiple school-based health centers are now able to enter data for all school-based health all of their school-based health centers at the same time. We've also spent a lot of time updating our database with the most up-to-date contact information. We want to thank those of you on the call who were involved in that process, our state affiliates and program offices, as well as local contacts in states where there aren't state affiliates and program offices. That information has all been updated in our database, and we're going to be able to pre-populate all of that contact information that you shared with us for the first time as well. The third exciting piece that you should know is that we've decided to partner with National Research, LLC, an experienced survey research firm that's based here in Washington, D.C. Why this is important is that they're going to be working with an experienced team who will be available to administer the survey by phone, if that helps individuals complete the survey more quickly. You'll very likely be receiving an email from National Research about completing the survey. So if you hear from them, know that they're our partner in this effort and working with us to make this a smoother, more efficient survey. When we launch the survey, we'll also provide the contact information for the appropriate individual at National Research who's leading the effort on their side. So now I'm going to get into the nuts and bolts of completing the 2016-17 census. So who's participating in the census? We will be asking every school-based, school-linked, mobile health, and telemedicine program in the nation to participate in the 2016-17 census of school-based health centers. And this year, for the 2016-17 census, we're going to have a special focus on telemedicine programs, those programs for which 100% of services are provided through telemedicine technology. We're going to have a special set of questions uniquely tailored for those programs. This is an emerging model of delivering school-based health care, and the census is a great opportunity for us to learn a bit more about how those programs are delivering services, where they're located, their staffing, their funding. So many of the questions will be directly aligned with the main census, but we'll have a special set of questions. Nirmita will also be showing you, if you're a telemedicine-only program, how you'll be completing the survey. So who should complete the census? We are asking that the person who is most knowledgeable about the care delivered in the school-based health center to complete the survey. This person may be a director, a manager, an administrator, a CEO, a provider, a clinician, or an administrative staff member. There are questions, which I'm going to get into on the next slide, about information about the sponsoring administrative organization, hours of operation, populations eligible to use the school-based health center, the schools served by the SBHC, SBHC staffing, services, policy, and electronic health record use, funding sources, and client and visit data. So when you're thinking about who's the right person to complete the survey for your school-based health center, this is the type of information that we'll be asking. We'll also have a list of the questions available on our website very soon. We're in the final stages of making revisions to our questions, so as soon as they're complete, they'll be up there. But all of this information and the questions themselves will be helpful to you in determining the right person to answer to complete the survey for your school-based health center. I want to pause for just a moment to talk about the client and visit data that we'll be asking as a part of this census. In the past several censuses, the Alliance hasn't asked the field to share information on client and visit data. As sort of the healthcare system transforms, this is the type of data that we have to be able to report to show our value add to the healthcare system. So we're going to be asking school-based health centers to share with us the total number of unduplicated clients who had at least one visit of any type to the school-based health center during the school year, as well as the number of visits of any type provided to SBHC clients during the school year. So how long will it take to complete the census? I mentioned it at the beginning, but one of the things that's really changed for this census is its length, and we think that it will only take about 15 to 20 minutes to complete the survey. So how is the data used? The School-Based Health Alliance uses the data we collect from the census constantly. We use it for advocacy and for technical assistance. So when our advocates are out there at local, state, and national levels, encouraging support for school-based health centers, data from the census allows them to tell a more compelling and accurate story. When we're asked and to provide technical assistance and share information about where are school-based health centers, how many of them have a mental health provider or a health educator, who's paying for them, and how long have they been in existence, we can answer these questions because of the census. We also use the census data for research to better understand trends over time in how school-based health care and school health services are being delivered. And finally, we use the data to update information in our Children's Health and Education Mapping tool. For those of you who may not be familiar with our mapping tool, this is a tool that we created to support advocates, researchers, and other key stakeholders in answering basic questions about school-based health centers. It's an interactive mapping tool powered by GIS, and it allows you to look at information about school-based health centers and view where they are located, and also see where they're located in relationship to areas of need, so where there are high areas of poverty or eligibility for free school meals. You can use this tool to look at those relationships. The tool is available on our website, so we encourage you to explore it further. So what do I receive for completing the census of school-based health centers? We're offering a few incentives to start off the process of data collection and offering that the first 5 individual respondents in each state to complete the survey will receive a $10 gift card. We're also offering the first 3 state affiliates to help achieve a 100% response rate in their state will receive a $100 gift card. This excludes states with less than 20 school-based health centers, and we hope to offer more incentives as the process goes along. At the end of the survey, all school-based health centers who complete the census will receive a free copy of the census report and a tip sheet about how you can use this data in practice. And state affiliate organizations and program offices will receive a copy of their state's data if at least 60% of SBHCs in the state complete the survey. So when's all this going to happen? Our target to launch the survey is next month in April. We are shooting for mid-April, and as soon as it opens, there will be an announcement to the field. Our goal is to reach 40% completion by the convention in June. So what's unique about this survey is that we're launching it during the school year. The time period that we're asking the health centers to report on is the 2016-17 school year, and we're opening it during this school year so that folks can get a head start in completing the survey before the summer. We hope that we'll be celebrating at the convention that 40% of health centers have completed it. And we need your help to get there, because our target for completion is November of this year. By November of 2017, we hope to reach 85% completion. Our target for the census is to see 100% completion, but we won't close the survey until we've reached 85% completion. This is because our goal is to clean, analyze, and turn the data back to you as early as possible, and our target for that is early 2018. So I'm going to turn it over to Nirmita now, who's going to give you a demo of the data portal. The census will be administered through an online secure web-based system. So this is the system that you will be using when you complete your survey. So if you can just hold on one moment, we're going to transition over. All right, thanks, Haley. We are excited to share the redesigned census portal for the 2016-17 census. This year's portal is more user-friendly, and it allows for respondents to complete the survey for multiple SBHCs at one time. So now I'd like to take a few minutes to walk you through it. Let's start by imagining that I am a healthcare administrator for SBHCs in Colorado. And please note that this is just a scenario to show you the different options. I do not necessarily have the correct information for the sponsoring organization or SBHCs. So I'll start by selecting my state here, which is Colorado, and then my sponsoring organization, which is Metro Community Provider Network. And if you do not see your lead sponsoring agency from this drop-down, you can also start the survey by clicking here, on Search Your State's SBHCs to select your SBHC. So here at the top of the Lead Sponsoring Administrative Agency Information page, you have the opportunity to update contact information for your sponsoring organization. Then you will be asked about some characteristics of the agency. So let's pretend you are an FQHC, you are not a telemedicine-only program, and your primary funding sources are federal government, state government, and private foundation. So on this next page, we want to know if all individuals providing care are employed by the lead sponsoring organization. Now let's say that this is not the case, and there are other organizations that provide mental health or oral health services. In this case, you would select no to this question, and then you would be able to provide information about the other organizations below. For example, suppose a community-based organization provides behavioral health at your SBHCs. You can select the type of organization from this drop-down, type in the name of the organization, and then you can select behavioral health. Now we are at a page with a listing of the SBHCs sponsored by the agency based on what we have in our database. Here, you can select which SBHCs you would like to complete the survey for by selecting the boxes on the left. So I'll select Stein Kids Clinic, Alameda Kids and Teen Clinic, and Jefferson Kids and Teen Clinic. And if you know that a site is closed, you can also use this column here on the right to indicate that. And if you do not see your SBHC, you can add it here by selecting Add SBHC. So this is the main dashboard for the Census portal, which we are still making a few modifications to. But here you will be able to track your progress toward completion, and you can see each section of the survey. For example, the schools served and the section on health center demographics. So let's get started by selecting schools served. And you can do so by clicking on Edit Data here on the right. So as you can see on this page, you can review the schools that are served by each SBHC clinic that you selected. You can also remove schools by clicking Remove School on the right, and you can add additional schools if needed. So for example, for Stein Kids Clinic, I can click on Add Schools Served by SBHC, and then once I'm here, I will search for my district, which is Jefferson County Schools District. And I can individually select the schools that we serve. But if I know that all schools in the district are served, I can click this button, and it will go ahead and select all of these schools. So once you've completed this process of selecting all of the schools, suppose you want to return to the main dashboard. You can do so by selecting Save and Home here at the bottom. So now let's move on to the Health Center Demographics section by once again clicking Edit Data on the right. So for this section, you'll see there are 3 questions. And with each question, you have the opportunity to select an answer for each SBHC. For example, in question 2, you can select the populations eligible to use SBHC services. So suppose for Stein Kids Clinic, your answer is students enrolled in our schools and students from other schools. You can select these answers and then move on to answer the question for Alameda Kids and Teen Clinic and the Jefferson Clinic. Now, once you've completed this section, if you're ready to move on to the next section, you can click Save and Continue at the bottom of the page. So this brings us to the Health Center Operations page. Now let's pretend that you have information for question 4, the year the SBHC was established. So you can go ahead and type in 2001 for Stein Kids Clinic, 2012 for Alameda, and 2012 again for Jefferson Kids and Teen Clinic. But for question 5, which is asking how many hours per week was the health center open during the school year, you need to verify this information with a colleague. At this point, you can save the information you've provided so far and then come back to the survey portal when you have the answers for this question. So you can do this by scrolling to the bottom of the page and simply clicking on Save. So now that we have reviewed several sections as an SBHC administrator in Colorado, let's switch gears and imagine that we are administrators for a telemedicine-only program, which means that 100% of services are provided using telemedicine technology. So we'll go over here and start fresh, and let's go ahead and choose North Carolina from the state drop-down. And then for the lead sponsoring organization, we'll select the Center for Rural Health Innovation. Now, as part of the telemedicine program on this page, when I get to the second question, is your school-based health program a telemedicine-only program? If I select yes, then this button at the bottom pops up, which allows me to continue on to the telemedicine survey. So when I click on this button, this will allow me to continue on to a survey designed specifically for telemedicine-only programs. The questions are similar, but there are several questions that are specific to telemedicine healthcare. All right, and this concludes the walkthrough of our new portal. And we will now open the floor for questions about the portal or any other census-related questions. So if you can type your questions into the chat box, Tia will read them and we'll try and address them. All right, So we're going to get started. Thank you for entering your questions. So the first question says, for question 4, this information has been entered on previous census surveys. Why can't that information be pre-populated? It doesn't change. So we have made careful and strategic decisions about which information is going to be pre-populated and what information is not going to be pre-populated. So many changes have happened with our data collection system and the survey itself since the previous census that we are asking people to share information with us for many of the questions. I guess for the question that's most obvious is the year that the health center opened. We're going to be asking you to complete that once again. The parameters we've set in this question with our new system are putting boundaries, because we had folks that were saying that their health center opened in like 1874. I mean, that would have been wonderful, but we weren't really aware of school-based health centers that were open at that time. And so we don't want to bring poor data into this new data collection system. But I can tell you that every effort going forward is going to be to ensure that we pre-populate data that was in there before. So that's why we've elected to pre-populate contact information to the greatest extent possible, but to the questions we're not bringing over previous data. So good question. Thank you. We are very much working on this. So the next question is, if during the school year the clinic is only open to students within the school and during the summer it's open to the community, does that need to be noted separately? No. I would just answer the question that you served both communities, because it's during the, you can include the summer in the 2016 school year. Great question. I would just select all of the communities that are eligible and to use the school-based health center at any point. So the next question is, what if you offer both telemedicine sites and traditional sites? So in this instance, you'll be asked to complete the primary census survey for the bricks and mortar school-based health centers, and then you'll be asked to go in separately and complete the separate telemedicine census for your telemedicine school-based health centers. This is new territory for us, so we appreciate your patience as we sort of work through that challenge. We're not aware of a lot of programs where they have both bricks and mortar and telemedicine only. We're aware of a lot of programs that are sort of fixed bricks and mortar school-based health centers that provide some services via telemedicine, in which case we want you to respond to the sort of primary census tool, and you'll be asked to share which services are provided via telemedicine. But if it so happens that you have some school-based health centers providing care via telemedicine only, we'll ask you to complete a separate survey for those school-based health centers. So the next question is, our health center closes on June 30th of 2017 for the school-based health center. Do I need to complete my survey before the conference? This also will be incentivizing programs that end earlier in the school year using the current incentive program. We are hoping to see 40% completion by the time of the convention, which is this year, from June 18th to the 21st in Long Beach, California. So before June 18th, we want to see as many school-based healthcare programs complete the survey. You can complete the survey as soon as we launch it in April. Those incentives that we're starting with are to encourage health centers to complete it before the school year ends. You might be asking, but what about the client and visit data, where we're asking for the total number of visits to the school-based health center? You can return after the school year ends to answer those questions if you'd like and complete your survey, or you can provide an estimate based on what you know at the point in time when you complete your survey. But yes, please, we encourage you to complete the census before June, when we'll all meet in California for the convention. The next question is, will state affiliates have the ability to see what school-based health centers have completed the census in order to encourage the ones that have not completed it? That's a great question, yes. On our webpage, which we're currently building, you'll be able to see a list of every school-based health center in the by state and whether or not they have started, partially completed, or completed the survey. You'll also be able to see the percentage of school-based health centers in a particular state who have completed the survey. There's always a healthy level of competition with the census, where states all try and reach towards 100%, and these sort of mechanisms will help you be able to see and will help the folks in place in the states who are encouraging completion to see which health centers still need to complete their survey. The next question is the question related to who is served. If all the SBHCs are the same, is there a way to check all the sites at one time instead of each? My response is somewhat similar to the question about pre-population. We've come so far. It is our absolute goal to be able to allow folks to be able to select all that apply. I'm not sure if we're going to be able to get there for this census, and I'm not sure if we'll be able to get there for all questions, but we may pilot that ability with a couple of questions. We're still working on the technology with our system to be able to allow that to happen, but it's a great idea. It's something we considered. We're working on it, and if you don't see it in this census, you will see it in the next. The next question is, I participated in entering my data for the first half of the school year and experienced issues on the website. Will additional vetting of the website occur before the major census? Yes, great question. All of this work that we're trying to do to improve our systems takes time. We will be working in the coming weeks in advance of launching the census. We have been doing a tremendous amount of work internally, and in the coming weeks we have asked several individuals in the field who will be completing the census from multiple surveys to pilot the data collection system for us. So we hope to work out as many of the kinks as possible. Thank you for that question. So the next question is, what year do you place if another company was operating the school-based health center before us? I think that you just place the year that the school-based health center opened, regardless of who was operating the school-based health center. If it closed for a substantive number of years, then you may consider putting a more recent date. We'll leave that up to your judgment, but I would consider putting in the year that the health center originally opened. That's all the questions that I see right now. If anybody else has any other questions, we'll wait another minute or two for you to enter them into your chat box. All right, we don't see any other questions coming in. What we can tell you is that we are currently building a website where we'll have a frequently asked questions section. We really appreciate all these excellent questions you asked today, and we'll be incorporating them into that frequently asked question page. We'll also be sharing our contact information at the end of the webinar, so if you come up with any additional questions, we'd love to hear from you. So, in wrapping up, here's mine and Nirmita's email addresses. Please feel free to contact us with any additional questions that you might have. We also want to encourage you to become a member of the School-Based Health Alliance. If you go to our website, you'll see a link to become a member. We would love to have you join us. And finally, we hope to see you in California. As I mentioned, our convention is in Long Beach, California this year. It's June 18th to the 21st. It promises to be a great event, and we hope to see you there. So as we finish up here, we're going to bring up a couple of poll questions to ask whether this webinar met your needs. We would love it if you could just take a quick moment to answer these questions for us. All right, thank you. The second question is,
how well did the presentation meet the stated objectives? Thank you. Our next question is, how likely are you to apply the information from this presentation in your organization? Would you recommend this webinar to others?
all right, thank you everyone so much for participating in this webinar this afternoon. We really appreciate it. There's obviously much more to come. Please reach out to us if you have questions between now and April when we launch the survey. And as soon as it's launched, you'll be receiving information from the Alliance. So thank you again, and we hope everyone has a great afternoon. Bye.